One was a question about rotator cuff tears. What's the deal with them? Can you tear it more? And how careful do I need to be? It's really the basics of this question. So the answer to that is it depends. Without giving an hour lecture on rotator cuff tears, I'll say this, that basically tears have different sort of grades to them. So it depends, how severe the tear is. So you need some information from their doctor about tears. There's no way for you to know how torn something is. But that said, unless it's like really intense, so they usually grade them. So if it's like a low grade tear, which is kind of the most common thing, especially if it's not a trauma, if it's just like over time. See, a lot of people have tears, and usually when a yoga therapist gets that, they've been to PT. And so this has been my experience. This is just one possibility, but a lot of times they've gone to PT and they've done rehab exercises that have either worked partially or not worked. When they haven't worked, it's usually has something to do with, well, there's lots of reasons they could not work. But often what you see as a yoga therapist sort of coming in after all that is, or what I've seen, is that the PT has given them exercises that were too strong. They didn't sort of work on them gradually, and so that was a problem. The other thing I see kind of commonly is with older people, say above 60, sometimes they kind of write them off like, yeah, you have rotator cuff tears and here's a couple exercises. And, obviously no PT or physio should do this, but it just kind of happens a lot. I don't know if it's just because of ageism or because I just see so many and it's kind of a mill and it's hard to keep track of everyone. But they kind of say, well, you're good enough. So I get a lot of those. So one thing to remember is that, non-painful movement is really important. So sort of non-weight bearing, no pain movement to warm up the area, and also to sort of treat whatever arthritis may not be in there coexisting with the tear. So that would be good. So do a lot of that, a lot of moving and breathing. And then when you start to strengthen, one of the key things is to, do it in a way that's suitable to their shoulder. And you can't always tell while you're doing it. So a lot of times it'll feel fine in the session, but what you want to do is follow up and make sure that you're doing things that don't really inflame it too much, say for the next day afterwards. So I always follow up with my clients. So those are the two things I would think about. The third thing is a technique. Actually, Karina in this course was teaching that to us on the last retreat. But where I've used forearm stand against the wall, sometimes on the floor, depending on the shoulder, to sort of reset the shoulder. I've used other techniques like that where you use the muscles, and then the working theory is other muscles take over, usually for the supraspinatus, which is torn. Her group has a technique where you do forearm stand against the wall and you relax your upper traps, and then right afterwards you kind of swing your arms up and down, and that sort of resets it for the day or forever or for a few hours depending on the person. So that's another technique that I could show you sometime, especially the person I was interested in, if you're interested. But the main thing is that you have to kind of stay on them and make sure that the strengthening exercises you're doing are not inflaming it too much, because it's a sign of a couple of things. But one is that you're really getting at the sort of attachment where it's torn, and that can be really dangerous. So where I've seen people make mistakes in the past is that where they don't follow up properly. And so the person seems fine, and then it swells up, and then the person, or it hurts a lot the next day, and then the person thinks, well, this is probably just part of me having a hurt shoulder. I'll just keep doing what I'm doing. And that's kind of the danger zone. So I would be careful there. So make sure you follow up. You want to talk to them on the phone the next day. You could do it by email. I try to actually talk to them so I can ask them some questions. Questions like, well, is your shoulder hurt today more than it did yesterday? Is it more sore today than it was yesterday? A lot of people, some people are pain sensitive and they'll always tell you something hurts. Other people go the other way and they'll be like, oh, it's fine. I have a guy like this right now, actually, I'm working with, who says, oh, yeah, it's fine, it's fine. But what it really means is that he can handle the pain. So you have to ask more specific questions. Like, is the pain today worse than it was when we were working yesterday? That's a very specific question as opposed to, does it hurt? So just keep all that in mind.